Hi, and welcome to Itentive Healthcare Solutions webinar, using text messages to manage your waiting room. My name is Chelsea Grover, and I'm the Marketing Communications Coordinator for Itentive. Before we dive into today's presentation, I'd like to take a moment to explain the process for it. First, I'd like to mention that it will be recorded, and that we'll send out a copy of the slides and the recording within the next week. Next, for those of you who aren't familiar with Itentive, I wanted to share a bit of who we are with you. We specialize specifically in NextGen healthcare, and we're passionate about providing solutions for our healthcare provider partners, which in turn help them to improve patient care, enhance the patient experience, and maintain a financially healthy practice. To sum it up, we do everything NextGen. And we also have some NextGen add-on productivity solutions, including ChartGuard and Refund Manager. Next, I wanted to mention some upcoming educational webinars that we'll be presenting in the near future. On October 7th, we'll be presenting everything you need to know about e-prescribing. And later in October, we'll be doing a webinar on dealing with patients in the new consumer-based healthcare arena. We'll send out details and links to a recording and registration with a link to the registration within the week before those presentations. So keep your eye out for those. Okay, so back to today's webinar on using text messages to manage your waiting room. At the end of the presentation, we'll open the floor up to questions from you. We'll answer all the questions at the end, but you can type them in the questions area of the webinar control panel whenever they occur to you. And finally, for audio clarity purposes, everyone's phone will remain muted throughout the entire webinar. If you experience audio issues, please use the chat box to let us know so we can resolve them. And again, questions may be entered in the questions box. So, without further delay, I'd like to introduce our presenters for today. Lindsay Lanning is our healthcare industry expert, so she's in a great position to talk about fighting COVID with technology. Cindy Kincaid is one of the leading NextGen experts in the healthcare IT realm, so she's the perfect person to talk about why we've created our solution. And Joel Schultz built our solution, so obviously is the best person to go into details and give a demo. So Lindsay, the webinar is all yours. Feel free to take it away when you're ready.
Perfect. Thank you, Chelsea. And hi, everyone. Thank you for joining us today for our webinar on minimizing patient spread of diseases by actively managing your waiting room patient flow using text messaging. Quite the mouthful for our title today, but nonetheless, an extremely important topic in today's healthcare industry. This is a pretty unique presentation we have for you today. It is a hybrid between our educational webinar series, where we focus on industry and NextGen topics, and our solutions webinars that gravitate, towards the products and services that we at Itentive can provide to assist your practice in some way. I wanted to mention this, right away, right out of the gate here, as after we work our way through the informative content, we will actually be providing a demo of the solution we created to help NextGen clients manage a waiting room using text messages so patients can actually wait in their cars. This is a little different, than some of you may be used to, but I think today's presentation will be really interesting and interactive. And my hope with this is that you will take a step back and think about the future of healthcare post-COVID-19 and the long-term impact it will have on your practice. Because we know healthcare has been changed forever by this pandemic. And one area in particular, that we don't believe will ever be the same is the traditional waiting room. Thinking about our lives in this, new normal, we realized that one of the most important areas to change was how to handle people waiting to be cared for by your practice. No one wants to wait in close proximity to others, and we know that we're going to have to keep our distance from others for the foreseeable future. So we're encouraging you to use this as an opportunity to actually change how your practices serves your patient population and provide a more efficient and improved patient experience. We also know and embrace the healthcare industry's acceleration towards digitalization, and that includes the patient queue. So we created a solution that can really transform your practice to support a virtual waiting room that seamlessly integrates to your NextGen system that's also inexpensive and easy to implement. So on today's agenda, we will look at the pain points of traditional patient registration and waiting rooms and why they simply can't exist in today's reality, and then move on to the role of the virtual waiting room. After that, I'm going to turn it over to Cindy and Joe to take us through the product and provide a demonstration, which will be followed by your questions at the end. So let's get started. But before we dive in, I wanted to kind of get a lay of the land here and see where everyone on today's call is currently with how you check in or register your patients at your practice. So we're going to go ahead and launch a poll. It should pop up on your screen, and we would like you to choose one of these options. So, are you still using paper, pen, and a clipboard to get your patients kind of checked in and get that information? Maybe you have your forms being sent through the portal beforehand. Do you have a kiosk in place, or, maybe a tablet system like Phreesia for this? Or are you even still using verbal registration in the office, with that front office staff doing kind of the heavy lifting here? And if there's anything I forgot about, a different scenario, go ahead and select other. I know if you have a kind of a hybrid option here, go with whichever one you think best describes your practice. So we'll give it, a minute or so to make sure everyone has had a chance to answer. And I'll kind of tap on Chelsea here to let me know what it's looking like
Yep, it
as
looks
the
like a lot
responses.
of the votes are in, but looks like we're waiting on just a few more. So let's give everybody another 10 seconds to finish getting this in.
Perfect.
Okay, I think that we're going to go ahead and close the poll. So let's see the results. Close and share. Here we go. So it looks like about half of you are still using paper, pen, and a clipboard. Then the next most popular is the kiosk or tablet registration in office. Close tie for other and online patient portal forms, followed in the rear by verbal registration with e-signature at desk.
Awesome, awesome. I wasn't surprised, to have that lower percentage for verbal registration, but it's not far off from the others. I'm intrigued by the other selection, but that's a topic for another day. But that paper and pen and clipboard, I expected that to be the heavy majority, and that's something to consider as we kind of go through this process of what's expected. The online patient portal forms, with the NextGen patient portal, especially that new awesome PXP patient experience platform that they have to allow those robust capabilities, I'm sure we'll see that percentage increase as well. And the popularity of kiosk or tablet registration in office as well increasing. So, the point of this was yes to get an idea of where everyone's at on that electronic data collection spectrum, as we'll call it. But it's also to highlight that no matter what registration method you have in place at your practice, if your patients need to actually come into the office to go through this process and wait to see their provider, there are still going to be 3 distinct challenges with that current environment surrounding COVID-19. So first off is going to be items are passed between patient and staff. So this is especially true if you're using paper and pen, which a majority of you all were for your patients right now. Think about those items being passed back and forth between staff, between the patient. I don't know how we would exactly disinfect paper. It's a challenge. But that even holds true for things like a tablet or even a kiosk check-in, where patients are in contact with an item or a device and it's collected or touched by others. Challenge number 2 is congested patient waiting areas. If your patients are still coming in to check in and waiting to see your providers, no matter how hard we try to prevent this through, spaced out seating, I've seen revised schedules with a lower patient volume trying to space those out, hoping, for a smaller amount of patients in there at the same time. Things happen and this waiting room can get crowded if appointments fall behind, if anything were to happen. And then challenge number 3, screening patients for COVID symptoms. So right now, almost every organization, whether it's my doctor, my dentist, or even my nail salon, when I call to schedule an appointment, they ask me a series of COVID-19 screening questions. I'm sure we're all familiar with these at this point. And while these screening questions are meant to assist in the prevention of the spread of the virus, if your patients are physically in your office and still answer no to all of these, we have to keep in mind there is a percentage of patients who are asymptomatic, and they would have no idea that they're sick. And now they're in your waiting room, putting your staff and other patients at risk. So while these challenges are relatively new, and have definitely been put to the kind of forefront here due to the pandemic, they are still things to consider in the long-term future. So how are we fighting COVID right now with technology? Well, we've seen an unimaginable upswing in telehealth visits and remote patient monitoring over the past few months. I mean, there's no question COVID-19 has acted as a catalyst to really accelerate the adoption of new technology and modernize healthcare communication. But the real question is, what will stick around and how will it be sustainable? I think, like I said, we can all agree telehealth has made probably more progress in the past 6 months than it has in the last 5 years. And patients like it, they want it, and I just don't see this going away. With that, we've seen an increase in kiosk check-ins, limiting, at least some of that exposure and human contact as well, as well as a large rise in patient portal forms and secure messaging. Like I said before, those that, NextGen PXP portal allows for. But we have also seen a steep increase in what we will call virtual waiting rooms. Now, keep in mind in the current coronavirus climate, the model of care delivery, as we know it, has been completely flipped upside down and landed on its head. The waiting room is one of those steps in the care process that we've taken for granted forever. Hospitals and clinics must now keep patients distance from each other as long as possible. So rather than having waiting rooms, as staging areas for patients en masse, we need to find a way to get patients directly into their exam room without any type of crowding. This is where the concept of the virtual waiting room was born. Gone are the days of, the upholstered chairs, old magazines, and trying to find a seat after checking into the front desk. Your new waiting room is the inside of every patient's car, where they control their music, the temperature, and they're likely using their smartphone to check email, social media, or even stream a show. We actually made jokes at first about this. Who would have thought practices would be more concerned about the last time they paved their parking lot or filled those stubborn potholes than making sure their magazines were up to date or what channel was playing on the TV in that waiting room. But then we realized, how important this concept was and how likely it is to become a permanent fixture in our post-COVID reality as well. I know, no one on this call could have imagined a year ago that standing in a long line, keeping a safe distance from others, and wearing a mask while waiting to buy groceries would become an everyday scenario around the world. The waiting experience has drastically changed due to this pandemic. This new reality is really pushing industries such as healthcare, even retail and banking, to reinvent their businesses to keep creating and delivering excellent customer services and experiences. So like I said, one positive aspect that has arisen from this is the acceleration of that digital transformation. So in this context, we are talking about that rapid development of virtual waiting rooms. These rooms are helping healthcare practices adapt to social distancing measures, optimize time and cost, minimize the spread of illnesses among patients, and meet patient expectations. So in the healthcare world, waiting rooms have never exactly been associated with a joyful experience. Patients, especially those experiencing white coat syndrome, often spend their time in the waiting room filled with anxiety about their appointment, with really, nothing to distract them but a few of those magazines, on the table that have been flipped through by hundreds of other potentially sick patients. And, maybe if you're lucky, there's a crying baby sitting 2 chairs down. That combined with the frustration of a long wait time during a patient's busy day, as well as the consideration of being surrounded by other sick patients, it's just not ideal. So what is the solution to this unfortunate problem? Even after COVID-19, when we think of flu season moving forward, it's still going to be virtual waiting rooms. They allow for zero contact experience between patients and staff. In general, when a patient arrives, instead of exiting their vehicle, they're going to send a text message to a designated number at the practice and announce their arrival. The practice can then text the patient updates until they're ready for the patient to enter the practice for their appointment. So these updates, think of complete pre-registration paperwork, and maybe it's a link to that. Maybe even updates just saying, hey, we're running behind, or please come in for your appointment. The options are kind of endless here. So we are confident that the ability to wait in your own car rather than in the medical office would actually make any patient happy. This experience allows your patients more personal time to spend as they please, in the comfort of their own vehicle. They can do things like jump on a work call, FaceTime a family member, and more that they couldn't normally even in your own waiting room. Now, going beyond that elimination of a long and anxiety-ridden wait time, virtual waiting rooms also provide a crucial benefit of minimizing community spread illnesses. So, right now in the era of COVID, both medical staff and patients alike have a true heightened awareness of the risks posed in medical office waiting rooms. Patients are seeking outpatient medical care. It's a mix. It's a variety of healthy, but also could have a variety of illnesses with any level of complexity and severity. So a crowded waiting room full of both healthy and sick patients makes infection control pretty difficult. And many patients have even postponed visiting their healthcare provider because of the fear associated with contracting COVID-19. So I think after living through this pandemic, most people have come to expect a higher standard of protection when it comes to minimizing the risk of spreading diseases. And we don't think this expectation will go away after COVID-19. People will be much more aware of germs and disease transmission for years to come. A virtual waiting room will provide more comfort to your patients to know they will not have to be in close proximity to other ill patients. It may even be the push some patients need to actually return to seeing their healthcare provider. So if you still aren't convinced of the benefits, of implementing a virtual waiting room, consider how much easier it will be to meet social distancing requirements and those guidance that are put in place. Not to mention, I think it's safe to say no one enjoys wearing a mask all the time. So without having to sit in a waiting room, patients will need to wear their mask in the office for less time, increasing the chance that it will remain on and properly. Another consideration is the constant disinfecting of surfaces that must occur. With those stringent disinfecting guidance in place, the reduction of patients sitting in that waiting room will actually save your staff time and energy to disinfect less often than they would need to if that virtual waiting room were not in place. And lastly, consider using your virtual waiting room to market your practice. Patients are already starting to assume that virtual waiting rooms are the new standard in most medical practices. Make sure they know you are proactive and already have yours implemented to make their care as safe as possible. We actually did a whole webinar last October on your practice's online reputation and the impact it has on your bottom line. And this is a great example of something that increases your patients' trust, their satisfaction, and their overall confidence in your practice. So just to kind of elaborate on this idea here, as using the solution as a tool for your practice to increase patient engagement and contribute in a positive way to your practice reputation, I think it's obvious today's patient population is dominated by healthcare consumers who want, and I crossed it out, no, expect digital resources to be readily available to them. As customers, we've become accustomed to using virtual systems in every aspect of life. We know digital technologies are widely used in almost every other industry to facilitate transactions and make processes more efficient. For example, when you go out to eat, you're probably used to putting your name in and getting a text when your table's ready versus waiting by the host stand. So why would healthcare be any different? I know Cindy had another great example of her recent experience, with the same expectation in another industry that she wanted to share. So Cindy, feel free to jump in and share that.
I think most of us, as we live through this COVID crisis of without having our nails done, our hair done, all of the things that happened, when we was finally reinstated, everyone was looking forward to that. And the group that I go to actually implemented all of this. They kept all of their current reminders in place. They kept all of the phone calls in place. Everything was there, but they incorporated text messaging. And it's really nice. 20 minutes before the appointment, they tell me to come to their parking lot. I get there, I text back and respond that I'm there, and I've acknowledged by texting that I have, not had COVID, do not have a temperature, all of the standard questions. And then they text me to come in when the stylist is ready or the nail salon is ready. And I walk in, and that's great. They also can let me know if they're running behind. And it's actually much nicer than going and sitting inside, particularly now that you can't have magazines, you can't carry your purses in, and all of the restrictions that have been put in place. So it's something that we've really enjoyed, and it's actually kind of one of the catalysts as we were designing this to make this something simple like that. So now we're going to go ahead and talk about the virtual waiting room itself. And what we wanted to do is let you know why we developed this, as well as what it is and what it is not. So first of all, the waiting room is a straightforward solution that allows your patients to wait in their car until your practice is ready to see them. That's virtually it. The technology includes a series of text messages that can be customized, and we're going to show you how that's done in the presentation. But honestly, our goal was to keep this simple. As we worked through this and to talk to you about what this is and what it is not, one of the things that as our consulting team were going out, and we were contracted, frankly, much more actively than I had thought we would be when all of the practices shut down and the cities shut down, and it was just such a very strange and weird environment. I think we've all lived through that. One of the things that we were contracted with many of our past and even new clients was, how are we going to handle this? What are we doing? And many of them asked us to help them review certain things out there. NextGen came out immediately with the telehealth program, and it became part of the patient experience platform. That was a quick success. Everyone got that. Then you've also got the acquisition of MedFusion, which has continued to be the new patient portal, and that's also part of the patient experience program. Many people increased in that. They moved forward. They were looking for new ways to use their patient portal. Everyone had that. There are kiosk systems. All of a sudden, there was a renewed increase in Frisia, OTEC, Clearwave, all of the systems that we look at and deal with every day. But one of the things that seemed to be missing was an absolute foolproof methodology for texting a patient. I'm sure they're all going to have that. I'm sure these are going to be incorporated in everything. But we didn't want to fill that void. There's many excellent vendors out there. NextGen has many excellent features that they have available to them. That's not the void we were trying to fill. So what we want to say is it's not a patient portal. It is not an appointment reminder system. While you might be tempted to think it could be used for that, there are some holes in that. You don't want to take it to that level. It is not a kiosk tablet check-in. It is not anything more than a simple text messaging system that integrates with NextGen. I realize that's a double negative, but it's the best way I could come up with to say it. It is not anything more. Its main focus is to allow you to move forward and text your patients. So how are we different? One of the things that we wanted to talk about is that, again, we're filling a void. We absolutely recognize that many of the systems we work with and that we deal with every day and our partners in this are going to come up with something to complement their existing products to offer this solution. Some of them are already in place and kind of doing that in a way. So what we wanted to do is come up with a low-cost solution designed to complement the products and services you have in place. If you have nothing, you can use this. If you have a kiosk system, you can fill it in. If you have moved forward and you're adopting the new patient experience platform, this is something you can still use. You can use it as much or as little as you like. We don't want to have a long-term agreement because, once again, we are confident that many vendors are going to come up with this solution if they haven't already since the time we started developing this. This is something you can pick and choose to use temporarily, short term, and all we need to terminate the agreement is a 30-day notice so that we can take you through the cancellation process. It's simple to navigate. It integrates with NextGen. You don't need another screen. You can see it right within the NextGen appointment scheduling, and Jill will take you through that in the demo. And there's really no in-depth training. We have a very small implementation fee that we will help you set up because it's easy for both your staff and for your patients. So now we're going to turn it over to Joe to take you through the product features, give a brief description on that, as well as take you through a product demonstration. So Joe, it's on to you.
All right, great. Thank you. Thank you, Cindy. Thank you, Lindsay. Thank you to all the attendees today. Chelsea, if you can put us back on the slides real quick. So I have a few slides I want to cover before I get into the actual demonstration on the
Sorry
product
about
features.
That, Joe. Here you go.
No problem.
Should be coming back.
So we've talked about what the virtual waiting room is and isn't. Let's talk about how it actually is going to work in real life. All right, in a nutshell, we're simply using text messages to help manage your patient flow through the waiting room, right? I think we've all experienced this, as Cindy was given a great example. Other industries are using this, other people in healthcare are using this. Again, I think we've all run into it where now you get the text messages, hey, wait outside, hey, we're ready for you, come on in. So let's keep the people in the pipeline moving forward, and the pipeline starts, maybe when they get up in the morning, they do their stuff, they're ready to get in their car, come to the, building, sit outside in the parking lot, they're ready to come in. Maybe you need to send them a quick message, we're running late, sit tight. That's your pipeline of bringing them through this system, and there's text messages that can be configured based on your practice to accommodate that. All right, so is it easy to use? Absolutely. Our goal was easy to use, easy to implement. Okay, on the easy to use portion of it, the user interface, as Cindy just mentioned, is NextGen PM. All right, from the staff viewpoint, there's no third-party software to learn. There's nothing new to roll out to your PCs or Citrix servers. How easy is that, right? It's the software they're already using. We've just integrated it into the display of the appointment in NextGen PM. They can see where any appointment is in the pipeline. We're taking advantage of a user-defined field in the NextGen appointment book where you can show that and you can advance to the next stage in the appointment pipeline. And I'll show you how that works in just a couple minutes. As part of the setup, we'll work with you to define your specific pipeline, what you want it to look like, what texts you want to send out, how you want them worded. And your front desk staff just needs to, be aware that when they create an appointment to use this, they need to have a cell phone number on file in NextGen. and they need to be tangentially aware of the stages in the pipeline. There's some of them that'll happen automatically, and there's some that are manually triggered from the user-defined field. The messages also, those text, once we've set it up, can be customized in NextGen file maintenance. So what does this look like? Well, I'll show you in real life in just a second, but here's a screenshot of the NextGen appointment book, and you can see in the lower left there where we've taken user-defined 7 and put in our different stages of the pipeline. You'll see each of those have a triple. So we look at paperwork and we have Q, S, and A after them. What Q is we're queuing it up to go out over the text message interface. S is it's been sent out, so we've queued it, it's gone out, we've gotten acknowledgement, we flip it to S automatically, so next time they open the appointment book, you'll have it with the S version of paperwork. And then the A is acknowledged. We have the ability for them to just type a Y and reply back, and then it'll flip it to acknowledged. And of course, you can use that or not use that, but it's kind of nice because it gives a confirmation that the patient has seen and read the text message. And, you know, again, it's real simple for them. They just reply Y, and I'll show you what that looks like. The messages themselves, so what we saw on the other screen was the pipeline. The underlying messages, again, are a user-defined field in NextGen. Because these are all user-defined fields, once we get it set up for you, you can maintain the text of those messages using NextGen master lists, okay, in your file maintenance. So again, your user interface is NextGen. It's not all this third-party software you got to train your people on. It's the stuff that's built into NextGen that we're interfacing with and taking advantage of. All right, so is it easy to implement, right? It's easy to use, we covered that. The UI is NextGen. There's not a whole lot the staff needs to learn once it's configured. How much does it take to implement all this easiness on the front end? Is it equally easy on the back end? And again, the answer is yes. We wanted to make it so it's not a major project for your IT to implement, right? We're all busy, we're all doing extra work now, we're all worried about COVID, we're all doing extra cleaning, we're doing temperature screenings as people walk in. The last thing you need is another major project on your plate. So really the way it's built is that there's an agent that takes care of sending those text messages back and forth. And let's jump over to the demo machine and I'll show you that right now. All right, great. So what I did here is earlier I scheduled an appointment here for 12:30 so that it would kind of time out with the flow of the webinar. So what's been happening is during this time, it's been sending messages out, and we have a little monitor that we use so I don't have to hold my cell phone up to a camera here that is keeping track of the messages that are going back and forth. So on the left-hand side here, think of it as the practices cell phone sending messages out to the patients. So I've said, you know, just filter it by this one number that I've set up here. And go ahead and send them out. And then on the right-hand side is what the patient will see on their cell phone. Now it starts out at the beginning of the day with just an initial message saying, hey, you have an appointment later today, just letting you know about it. And then you can set up other messages in your pipeline as you get closer to the appointment. Now for the sake of this demo, I did several of them just a couple minutes apart. All right, because I didn't want to sit here and entertain you while they go, you know, 15 minutes between them. But in reality, you might do the beginning of the day one, you might do one an hour or two before, you might do one 15 minutes before, you might do one a couple minutes before, hey, are you in the parking lot? And they could reply yes to that. And then once you get through those timed messages, then you get to the point where you're going to trigger the next messages to happen. And those next messages in the pipeline might be, hey, come on in, or we'll bring you a clipboard. We got paperwork for you. It might be, hey, we're running late, sit tight. And then the final one, right, which is we're ready for you, come on in. So what does this look like in the appointment book? Well, as mentioned, we're using these user-defined fields. And the last message I sent out, as configured in the demo system, was the 5-minute warning. and the patient replied Y back to it, so it flipped down to the A, right? I remember I have these different messages here for, the one you need to worry about is queued, and then the system will automatically flip it to sent and acknowledged if they reply Y back to it. So that was our last message in the series. We'll see some of these have like an exact time after them, where it's 7 a.m. here. Some of them have a relative time where it's minutes. So obviously the ones at the exact time are going to send out at that time. So at 7 a.m. you may send out all your initial reminders for the day about those appointments. And then at several minutes before, whether it's 120, 60, 15, the system's smart enough to figure that out and send the message out at that interval for you automatically. And it'll keep going down these timed messages until it runs out of them. And then you get to pick when you're ready for the patient to come in. All right, so in our test case here with Sam, all right, Sam got the 5-minute warning. We acknowledged that might be your, hey, I'm in the parking lot. Okay, it's 5 minutes before, you should be in the parking lot, sit tight. And then if we want, we can tell Sam, you know what, it's gonna be a few minutes longer. So let's go ahead and pick that we're running late. Okay, now that'll queue up, and in a few seconds, it'll send out to Sam's cell phone. And then if Sam wants, they can go ahead and click Y, and then it'll flip back to that acknowledged status. All right, and the good news is they're still sitting in their car in their own little bubble in the world. They can make their phone calls, do their work stuff, check their email, social media, all the great things Lindsay mentioned earlier that you can do in your own bubble, which you may not want to do in the waiting room, right? You don't want to be on a big work phone call or something crazy like that, or a webinar, right? Okay, so now we go back here and we think we're about ready to let Sam in. We sent them the running late. We see Sam acknowledged it. We put in a message here, let's, just double, triple verify. Sam doesn't have any COVID symptoms. So we'll pick that message. It'll get queued up. It'll get sent out to the cell phone again. So we'll come over here and monitor our cell phones. And in a few seconds, we get that message. And again, if, in this one, we don't want Sam to text back all his, symptoms. So we provide the phone number. You can call us and, tell us about it, and we'll decide the path of action for you to come into the building. But we're going to say Sam doesn't have COVID, and Sam's going to confirm. That's going to go back to the practice. And then when the practice has gotten that confirmation, they can go ahead and proceed to the next stage, which is, hey, we're ready to see you. Okay. And these can be named whatever you want. The pipeline can be configured however you want them, with as few or as many messages as you deem possible. We just, like I said, put a lot of the kind of per minute messages in there up front. So I'm going to pick that we're ready. And then we'll flip back here. And it's about to refresh. And Sam on his cell phone is going to get the, come on in, we're ready to see you. Okay, so that's how simple this is. All right, forget this little application here. This is just a simulation of the text going out in the cell phone. Really, your interaction with this is in the appointment book and just a user-defined field. Now, if you don't want to text the patient, there's an option down here that you can set when you take the appointment where the patient might go, you know what, don't text me, I pay per message, whatever. So there's an option for do not text. The system also respects the standard where if someone replies stop, it will never text them again until, someone goes in and resets that status. So easy to use, easy to implement. How onerous is this from a billing perspective to set up? Let's jump back to the slides real quick. And I'll take you through what the pricing for this looks like. So easy to use, easy to implement, and really easy on your pocketbook, easy to pay for. And that was one of the things we wanted in the system, is it's something that you could kind of consider almost a no-brainer. The list price is $25 per month per provider for the service. There's a fee for the text messaging provider that's a penny per text message. So if you're sending several of these back and forth in your pipeline, your flow, then we're estimating most practices are probably going to have 10 or fewer per patient appointment, right? Maybe the initial message, maybe 120 minutes before, maybe the "are you in the parking lot" message, and then the "come on in, do you have COVID?" So your cost for each patient's appointment will probably be around $0.10 or less. All right, so it's real straightforward. And then Itentive is always high touch in our software installations. We don't throw it over the wall. We want to make sure that you get the software, it gets implemented correctly, and that it's working when you're ready to use it. So we do have a one-time install and setup fee that will cover that. All right. And then, as Cindy mentioned, 30-day notice. If you're dropping, a number of providers, you can drop them. If you, as a practice, have moved on to another system, you can let us know you're done using it. Hopefully you had a great experience and it solved kind of that gap problem that you have. I'm going to turn it back over to Cindy now to cover more about the company, and then at the end, we'll answer some of your questions.
Okay, thank you, Joe. Really, as many of you know, Itentive was founded in 2003. We have 20+ experience with NextGen, which leads us to continue to try to innovate and to come up with these types of ideas. This is one we're really excited about because it was just such a simple concept to maybe fill some voids that many of our clients were mentioning to us. We have 40+ employees coast to coast. We have over 350 clients using NextGen today, and we are a NextGen strategic partner, and we live NextGen every day. Again, it's something we really work to focus on. We love NextGen, and we're always trying to do things that we can do to assist them or even bring their products more to bear. We have an integrated solutions module, and what is that? We do consulting, compliance, and optimization, so clinical workflow and revenue consulting, customization, productivity, products, and enhancements. We also offer hosting and IT managed services, and then ongoing support, and a NextGen partner and authorized reseller. So once again, we live and focus on NextGen all day, every day. And in addition to this product, we have other product tools that we are offering. We are the authors of Refund Manager. Many of you on the call have that. We offer a multiple encounter billing manager, which is really a very helpful thing when you have professional and technical component billing or an ambulatory surgery center. We implemented the Freezer clinical interface for NextGen, as well as the unapplied and deposit manager. So right now we're going to turn it over to questions, and then we can talk about any next steps or any questions you may have about this.
Okay, perfect. Thank you so much, Cindy. And Joe, thank you for the demo, and Lindsay for the beginning information. If you have questions, you can type them in the questions area of the webinar control panel. It looks like we have plenty of time still on our hands, and we only have a handful of questions coming in so far. So if you have questions, we have time to answer them. Please feel free to just start typing them, and we're just going to go through them in the order that we received them. Is there a character limit on the messages?
I'll go ahead and jump in on several of the more technical ones. There is not a character limit per se on the messages, but for those of you who have someone using an iPhone and someone using an Android phone, what happens sometimes is the iPhone person will send a very long message without thinking about it, and on the other phone you'll get all these message segments. So the recommendation is to keep your messages 140 characters or less, kind of like a tweet, so that you don't get those multiple segments. All right, so that'll make it more readable for the patient on their cell phone, not knowing what kind of cell phone they have. Additionally, the 1 cent per message is actually each one of those segments, when it gets broken up, is technically a message in kind of cell phone parlance in their world. So, again, while there's not a limit, we recommend keeping it to about 140 characters or fewer.
Perfect, thank you, Joe. Next question, is it installed as an add-on in NextGen?
It is not installed as an add-on in NextGen because NextGen is the user interface, okay? As I was showing you, we take advantage of the user-defined fields in NextGen for the user-facing piece of it. Now, for the implementation, there is a service that gets installed that just kind of runs in the background, and your IT can go ahead and put that on a PC or an underutilized server, and that just takes care of contacting the text messaging service, sending the messages out, getting the replies back. And again, that itself was designed to be, minimally invasive as far as deploying it, so that you install the service originates inbound and outbound traffic, so it sends out the messages and it requests the replies. So that way, in most cases, most of you won't even need to do any firewall work or anything crazy like that to get it through. A few of you who are super locked down may need your IT to make adjustments, but if you're super locked down, I'm sure your IT is used to that.
Perfect, thank you, Joe. Next question. I apologize if I missed it. Where are the functions like greet established? The others seem straightforward, but unsure of where the greeting was set.
Okay. In the setup of the messages, there are kind of mail merge tags. So it's like if you've ever, used Word and Excel and, done just that, created a mail merge of documents. So we have tags in there for default greeting, if you want to include the patient name, if you want to use the practice phone number. And again, we'll work with you on setting up those initial messages as part of the install.
Perfect. Next question. Can you demonstrate how the link to the paperwork would work?
I can grab this one, Joe. There is no link to the paperwork in this. One of the examples was you can come in and grab the paperwork, or we will meet you in the parking lot with a tab if you're doing handwritten paperwork. If you have a portal or a kiosk or some other service or using the any other service to complete the paperwork, they would still continue to do that. This wasn't designed to jump in on that particular area.
Great, thank you, Cindy. Next question. Is the messaging history stored in the patient's chart?
It is not currently. We're just trying to create a simple solution to send the messages out, get the replies back. If everyone loves it and wants to keep using it, obviously that's, something we could do is keep a message history log. In reality, though, there's not going to be a lot of meaningful information in there because we're really not trying to collect PHI here. We're just trying to, move the patient through the pipeline.
Great, thanks, Joe. Is the setup fee per provider?
The setup fee is not per provider, it's per practice. The provider fee, the $25 per provider per month, so that will vary times the number of providers. But the setup fee is once, and kind of the assumption is they're all using roughly the same scheme of messages. So that would be defined on a practice basis so that it's standardized.
Great, thank you. We kind of touched on this one, but I'm going to ask it again. It's a little bit different. Can paperwork registration be completed through text?
Not in this system. We're not looking to solve those problems. There's other systems solving those problems. What we're looking to do is give you a simple way to fill in the gap between where you're at now and where you may want to be in the future, where you can do a virtual waiting room.
Great, thank you, Joe. When you ask, are you experiencing any COVID symptoms, is there a way to send a link for them to click on to see the list of COVID symptoms so they can answer truthfully?
Actually, yes, you could put the link in your text message and it'll come across, and on their phone, they'd see the link, they could tap on it and it should launch the browser, depending on their phone. On most smartphones, that'll be automatic when they touch it.
Great question. And it looks like this might be our last one, but we'll hang on for a few minutes in case there's any more. What platform are you using to send the SMS?
We're using, we reviewed several of the big vendors out there that are doing voice over IP and SMS. The one we settled on was a company, one of the big players that many of you may not have heard of, but they're big behind the scenes, called Twilio.
Perfect, thank you. And it looks like we do have a few more coming in. Do people have to opt in or out for this? Or opt in, or is there an opt out? I'll let you cover that one, Joe.
Yep. When you're taking the appointment, at the end of the list is a do not text option in that user defined field. So by default, they could be opted in. If you needed to more often have them opted out, then we could work with you on that and figure out the best way to do that. But by default, if you have a cell phone number and the do not text is not selected, they would be opted in. And then, of course, they could send stop to opt out forever. Yeah.
Perfect. Thank you, Joe. Is there a way for the patient to reply to let the office know if they've decided to leave because they were tired of waiting to be seen?
Currently not in the standard workflow, but you could actually put a message at the end where if you said, I'm ready, and they never showed up, you could queue up another message, which is, did you leave? And they
Are
could
you
simply
still there?
reply yes to that. Exactly. Hello, is this thing on? So yes, there would be a way to accomplish that functionality.
Yeah, Joe, from my perspective, as I was thinking that you could say the provider is running behind, could you even put a question there? The provider is running behind, the provider's still running behind, text Y if you wish to continue waiting, or text no if you want to leave, maybe even as an option.
Exactly. Yep, we could look at adding that. The Y is in there by default, and if you worded the question right, you could use it as is, and we could, easily add the negative option too.
Okay, well, it looks like that's everything for right now, but if you think of questions after the fact, you see you'll be receiving an email from me within the next couple of days here with a link to the recording and the slides. So you can always reply back to that email, and I'll make sure that your question gets to the right people, and we'll make sure that we get you answers. That's what we're here for after all. We hope that this webinar was relevant and informative, and don't hesitate to let us know if you have more questions. Thank you very much for joining us today.
Thank you, everyone.
Bye.